a national patient advocate foundation. We are the voice for the patients that we serve through Patient Advocate Foundation. And what we see today is that we had 103,000 cases plus in the calendar year of 2011. 64% of those patients had medical debt crisis that, if not resolved, their treatment was stopping. 70% of those patients had cancer. 25% of those patients are in Medicare, and they're living on average household incomes of $23,000 a year or less. And so we're very concerned about, number one, drug shortages. We've been to the FDA in September. We brought in a 17-year-old girl to tell the story of being moved off Doxil. Today you can go and see her on MSNBC if you visit the website. And she's in her hospital bed now, fully relapsed and moving into the late stages of her disease. Doxil was controlling the disease. She was moved to daunorubicin. She tells her story. When we look at drug shortages in oncology, and we see that the patient is now being counseled routinely on what your alternate therapy will be if we do not have enough drugs to get you through this, is of huge concern. So we went to the United States Capitol on April the 24th, and we conducted a briefing, and we brought in the 4 offices who have proposed solutions. As we know, Klobuchar's solution has been folded into PDUFA, so that companies will have to inform at least 6 months out that there's going to be a drug shortage. But it's interesting, when you talk to the companies, Selma, they will say to you very quickly, we may not know 6 months out that we're going to have a shortage. Senator Hatch is proposing a freestanding solution. It will not be addressed as part of PDUFA. We believe it's part of the right solution, which is to incent the production of these older drugs that we're working to control disease and to get these drugs back into the marketplace. We share a concern with Ted that our patients are having a tough time finding doctors. And if you're in Medicare or Medicaid, you're going to strike out multiple times before you find a physician. And so we've been a part of the working group with the providers, including ASCO, for more than 10 years trying to find a solution. Every year we get a Band-Aid fix. That's what we get. We're now at a place where physicians are leaving oncology because of the instability of their future. And so when an oncologist leaves, it's damaging to the entire community. The final area that we have a huge concern in, and if you visit our website, you can see many other concerns that we have, but we're very concerned about the essential health benefit discussion that's going on at the state level and the federal level around the exchanges. And while the exchanges are not due to be introduced until 2014, the states actually have to select their base plan by January the 1st of 2013. So many states today are drawing and making a decision of what the essential health benefits are going to be. If you look at the formulary guidance in statute, it says you have to have 6 classes of drugs, 2 drugs per class, consistent with the statute across the board. The Secretary has modified that somewhat and suggested we only need 5 classes of drugs and 1 drug per class in the essential health benefits. The damage this could render will not stop with people enrolled in exchanges. It's not limited to 32 million, because once the state adopts the baseline package of benefits in the essential health benefit, it will apply inside the exchanges and outside the exchanges. So we may actually see our insurance dumbed down from what we have today to a very different level.